Happy Sunday night before Thanksgiving. We're so excited that you joined us here tonight for our Savvy Chat. I'm Jen Horangeff from Savvy Cooperative, your host, and super excited about tonight's Savvy Chat because tonight we are joined by an absolute patient care pro with Miss Amber Soucy, who is also known as a Wheezy Nurse online. And she's awesome. And she's going to tell us all about her work as an RN at a surgical step-down unit in Boston. She also provides home care for an ALS patient, and she's a clinical instructor helping to train new nurses. And I also should note that she has recently been appointed to the board of Society for Participatory Medicine. So we couldn't be more thrilled to have you here tonight, Amber. So thank you so much for joining us, and let our callers know where you're joining us from tonight.
Hi guys, and thank you for having me. That was a wonderful intro. It actually sounds like I'm accomplished. I am calling in from Bellingham, Massachusetts. It's about 45 minutes southwest of Boston, Massachusetts.
Excellent. Boston, my hometown, so I'm super excited that we have you over there holding down the fort. And, we're going to dive into all sorts of things. I think it's really amazing to have you, somebody who's on the front lines working with patients, because here we always talk about the patient experience, but rarely are we actually talking about what is that day-to-day care like. So we're going to dive into a lot of that. But I think what a lot of our listeners or people who know you as Wheezy Nurse might have some questions about is, where does that name come from? Can you give us a little background about why you go by Wheezy Nurse?
Sure. So when I first graduated from nursing school, I wanted to start on Twitter and collaborate with different people that were nursing students and professionals within the field. I had heard that social media was a great way to do so. So I had actually started out as asthmatic nurse. And then based on, what was that?
More of a mouthful.
Yeah, it doesn't ring, like it just doesn't sound right. So based on my different specialties and the different facilities that I was working in when I was trying to get my experience as a nurse, my name changed. So I was psych nurse RN, prison nurse RN, and then it just got to the point where I was working in hospitals and medical, surgical, med nurse it didn't sound right. So I figured, why not focus on my chronic disease, and Wheezy Nurse, here we go. It ain't easy being wheezy.
And I see you there.
Hello, Sage. Thank you so much for joining. Thank you. Thank you.
That are listening in. So okay. So you've talked about also too that you have done nursing in a lot of different facilities. And, what I always like to know is, how do people even get into this line of care and work? So can you kind of take us through what brought you into nursing in the first place?
Yeah, sure. So I was actually torn between nursing and communications. If you know me, I like to talk and I like people and communicating with them. So nursing and communications, both of them kind of piqued my interest. When I was a senior in high school, I took an AP class, and it was AP Bio. Half of it was biology, and I utterly failed. It was terrible. Chlorophyll, borophyll, but then the anatomy component of it, I was going crazy dissecting, like to the point where my teacher had to get a little concerned. It's either you're really passionate or you're going to be a psycho. So anatomy it was so interesting, and knowing that everything in a split second can change, and if I am in nursing, I can help alleviate things and I can prevent things. It was just phenomenal. So I chose nursing, and honestly, I've never looked back. I still consider it part of the communication aspect as well. I communicate on a regular basis with my patients, and I find that I have a good bedside manner. So I do really enjoy it, and I'm happy that I got the best of both worlds.
Yeah. One of the things that I think is so unique in providing such amazing care is that you're using communication not only to talk about treatment plans between the patient and yourself and the other parts of the care team, but you've also mastered really connecting with your patients. And that's what, I've heard these stories that you've shared before about how you've kind of used Post-it notes to communicate with your patients. And for those people who are listening in that know Savvy kind of working in the design field, maybe some of our designer friends might think about Post-it notes of kind of mapping out the patient journey and jotting down, the different parts of what a patient experiences, but you're using them in a totally different way to communicate directly with your patients. And it just makes everything just a little bit better. So I really want you to kind of tell people what you do that's so simple, but has really made an impact on the patients that you work with.
So when I first started out in the hospital setting, I was working the evening shift. So I was doing 3 to 11 p.m. By the time I was going home and leaving at the end of my shift, all of my patients were asleep. So if I had a connection with someone or I wasn't coming back the next day, I'm not going to wake them up to say, it was lovely meeting you. No, I'm sorry you already took your Benadryl and I woke you up, but good night. I'm sleeping now. So I got to the point where I was always carrying around a bucket of Post-it notes. I would write down all of my notes for different lab work and everything throughout my shift, but then I started leaving notes on my patients' bedside tables. And I would try to incorporate something that I learned about them or something that we talked about that was a little inside joke. And even on days that I was coming back the next day, when I did, my patients would completely brighten when I walked in the room. Oh, Amber, I got your note. Thank you so much. I'm going to put it on my refrigerator when I get home. It was just this little thing of, I listened. I remembered you liked the orange popsicles. So I put your name on a few of them in the freezer if you want one throughout the day tomorrow before I get back to work. Just tiny little things. And it just seemed to make this huge difference, especially with my patients that were having these prolonged stays in the hospital. So I have actually continued throughout, and 5 years into my practice, I'm still doing it. And it's just phenomenal to see how something so little, especially in a world that is full of technology, something that is so old school can make a difference.
Yeah. You talk about perhaps ooh, I can. You hear that?
Yeah.
Is that coming from me? Let's try that. See if it goes away. You talk about, that some of the patients, they say they might go put it on their fridge, and it kind of resonates with me because when I was a child, I used to collect things from my hospital stays, be it from the hospital bracelets themselves. I also remember one time a phlebotomist gave me this Snoopy Band-Aid that I thought was like the coolest thing ever, and I put it in my sock drawer for years. So, I know how we start to collect some of these things, and I'm curious if you've ever heard if anybody's kept any of those notes.
So for one, I do have to ask, was the Snoopy Band-Aid used?
No, they put one on me, and I thought it was so awesome that they gave me an extra one. So there's something very simple that they just gave me an extra Band-Aid, and 34 years later, I remember this.
Well, that puts me a little bit more so settled now that it's not used. But yes, the answer to that question is yes. I actually just had a patient family a few days ago on my last shift. They were coming down the hallway. I was looking in a completely different direction. I turned and I saw this familiar face, but they just started bawling. And it was the daughter and the wife of a patient that I had for a few days. He had gone home. I had actually spent most of my shift doing discharge teaching and education. They videotaped it. And then everything that I showed them for dressing changes, each and every family member was actually trying and demonstrating and learning with me. Talk about compliance. So I would never be able to forget them anyway, but they came down the hall and I was like, you were over on 8 East in room 16A and your father was, why are you here? Why are you here? Is your father here again? And we got to talking, and the fact that I remembered them was one thing, but then the fact that they said they still had the note that I had left them, not even the patient, but I left them one and slipped it into the daughter's purse. And I said, just keep on smiling, think positively, everything will be okay. She had said, yeah, we have such and such a nurse today, but she's not Amber. And I lost it. I cannot even fathom how it's something so small, and I don't think anything of it. I just throw something in someone's purse, and it just made such a difference to the point where they were still remembering my name months afterward. It was amazing.
Yeah. Wow. Well, I think that, really speaks to how much you're connecting with these patients and how amazing just doing those little acts of kindness can be. And so, what I'm so grateful for too is that you're starting to work with others and you're advancing your career to make sure you can make the greatest impact. And so, you know, you've gone on to get your master's in nurse leadership, and I know many people around me have gone on to be nurse practitioners when they've gone back to school and get their masters. And so I'm curious, especially with NPs, and I know people don't like the term, but mid-level care providers being in such high demand, I'm curious why you didn't go that route.
Yeah, so that's actually the question that I always get. Why, if you were going for an advanced degree, didn't you just become a provider or a practitioner? And to be honest with you, I'm not there yet. I still want to learn, and I'm still going into work every single day and learning something new, and I want to absorb that while I can. I want to keep on learning. But also, I have such a passion for patient engagement, patient empowerment, the patient experience in general, that I thought it would be more valuable to me and more fulfilling to follow through with nurse leadership so I can eventually take on a role where I truly feel like I am making a difference. Right now, especially with the Society for Participatory Medicine, I became involved with them last year, and they focus on patients and providers being partners and working together to tailor care plans to be beneficial to everyone and to increase compliance and satisfaction with everything. That is something that I would love to do, especially in a leadership role, whether it be quality improvement or they actually have patient safety officers, and they're expanding quality improvement to also the experience. So there's a lot of new roles that are now encompassing the whole patient experience. I would love to personally do something like that.
Yeah, that's so amazing doing that work in a passionate way. Uh-oh, I hear it. Let's see if we can get rid of it. So, you talked about wanting to continue kind of that line of work, but you are also teaching. So I want to dive into this a little bit because I'm so grateful that we have people like you who are teaching the next generation of healthcare providers. So you're a clinical instructor, and my understanding is you're teaching first-year nursing students. Is that correct?
It is their first medical surgical rotation within nursing. So the only prior clinical experience that they've had is the first introductory fundamentals of nursing. So how to take a blood pressure and how to interact with a patient. But the first medical surgical rotation is when they start to administer medications. They're really critically thinking and assessing and doing everything all in one that they have learned from lecture. So it's now from basics to advanced.
Okay. And so you're getting them when they're really green in terms of like their patient interactions. So, I'm kind of curious, is there anything that you've seen that has been shocking that they, maybe were not prepared for, and perhaps in a negative aspect? Like what do you help coach them through when they're first getting in there that they may be a little bit shocked and unprepared for?
Yeah. So when new students come into the hospital setting, it's always completely different from their fundamentals. Usually they're in long-term care facilities or rehabs, and it's a lot of one-on-one time with the patient and just getting to know them and interacting. But now in a trauma one facility where I teach, it's really acute patients. So even on a general medicine floor, there's a lot within one patient. So not only are they admitted for sepsis and they have a raging infection, we have to treat the infection, they also have a gastrostomy tube and we're giving all the medications through that. So we have to think about different administration methods. They have oxygen, they have um, all these different wounds. So there's so much in one patient that they are shocked.
Mm.
It's funny how the mind thinks you're admitted for one thing, so that's the only thing we have to treat. But there's so much more with comorbidities and presentation of patients, not only just physically, but mentally, emotionally as well, that they're so surprised that there's so many other aspects of nursing that you need to roll all into one to just care for one patient.
Yeah. And you also, I know have had some really great experiences when you've been teaching nurses, what it's like to go that extra little step and make sure your patients really know that you care. So what kind of examples do you have in that regard?
Uh, well, to show everyone that I care, I usually just embarrass myself and show off my dance moves, and it's like, yeah, yeah.
And
Just
we're dancing right now.
our dance moves are pristine, my friend.
God.
But one thing that I've kind of continued to do throughout, when you ask a patient, one of the first things you ask them when you're starting your interactions with them, their name and date of birth. If they say it's within a week of their birthday, I am obligated to sing to them. I am obligated. I have to. I have to embarrass you. I have to close the door. I'll give you some earplugs if you want. I have to sing to you. It's just something I have to do. Usually people laugh and they don't think that I'm actually going to do it. But it was my patient's birthday that I had chosen for all 6 of my students to assess together as a group. It was one of the first weeks that I had them, and I had already discussed at length about the patient experience and just doing little things to show that you care. And then all of a sudden, I start singing. My students are like, whoa, oh my God, she was serious. She was really serious. The patient, she starts crying. It was amazing. And I walked out of the room and I'm skipping out and I'm all happy. They were so surprised that I had made such an impact to the point where the patient was crying. She had tried to be like this tough woman, and all of a sudden she just broke down. And they saw the bond that I made with someone within the first hour of being there, and they had pulled me aside and they said, "Oh my goodness, it's just these tiny little things that everyone thought you were joking, but you actually followed through and you did it." And they have taken that one instance and have then cascaded it into all of the patients that they've been taking care of for the entire semester. So whether it's just a touch of the hand before they leave, or even just checking in and saying, "Are you okay? Is there anything else you need?" I mean, they're always going in the patient rooms and they're actually interacting. And I think that's huge, because a lot of times students are so scared and they're timid because they might not know everything or they might not be confident in their skills. But even if you're not confident in your skills, you can at least find the resources to assist. So if you go in, you ask, you pay attention, and you listen, it's going to make a difference.
Yeah, well, I mean, as a patient, I can certainly say that for those people that just come in and they just ask their clinical questions, they just, looking down at their chart or entering it in on a computer or a tablet, that doesn't feel personal. It doesn't feel like they care. So just anything that really shows that they're listening, or that they're wanting to learn a little bit more about you, or care that you're here, or scared, or don't know what's going on, it really does make such an impact. And I'm curious too, you're training these students earlier on, and I know you've only, been teaching for so long now, but have you seen any of them later after they've come through their rotation with you? Do you stay in touch with them? Have you seen an impact that this has had?
Actually, yeah, I received a text a few days ago from one of my students that I had in the first semester I was teaching. This is only my second semester that I've actually had students, so I am still new. But one of my first students, he sent me this huge paragraph, and it was saying how in previous programs for nursing, he hadn't done well. He didn't finish the programs. He was discouraged along the way. He was told, you know what, if you're not getting it, then you might need to withdraw. There's no way that we can help you. It was very discouraging for me to hear that anyway. But I had taken the time and I had sent him resources via email. I had taken him aside and I had said, okay, look at this patient with me, walk through the process with me, tell me exactly what you're doing, exactly what you would do in this instance, and let's go through it together. And I really focused on trying to progress him and help him rather than just say, nothing we can do. So I actually reached out and said that I had made such an impact during his semester that he's doing so well and he's almost ready to graduate now, and he wanted a letter of reference. But just to hear that the few extra minutes that I took to step aside and talk to him really assisted throughout his education, it's phenomenal to know the impact of just teaching.
It's really a life that we all end up making such an impact on people's lives in this little ways that we don't know, the whole butterfly effect of you just never know how it's going to change somebody. And whether it's actually doing patient care or bringing patients in and listening to them in a design setting or being kind to somebody you see on the subway, it all does make an impact. And I think that you're such a great example of how doing that in the clinical setting is really impacting not only the patients and making sure their care is better, but you're making sure the next generation of providers is going to go that extra mile too. That, my dear, is fantastic. So that's amazing. I'm curious too, you know, as you look to what your future holds, I know that you just kind of got into this aspect of teaching, but do you have any sort of aspirations, like looking towards the future of how you see you might take this to the next level when you're ready?
That is such a great question. I have looked into a lot of different leadership roles and ways that I can kind of integrate everything that I'm doing now with both bedside care in the hospital setting, with teaching, with precepting, because I precept new employees at the hospital that I'm at right now. And there are a few different roles that I would love to take on, and some hospitals have adopted it, some haven't, but it's called an attending nurse. And I don't know if you've ever heard of something like that, but it's integrating being a team leader on the floor, assisting with care coordination, and then also the patient experience is a huge part of it. So a lot of times the attending nurses, whether there be one or two for a floor, will round on every single one of the patients that they have on their assignment, check in the morning and say, okay, what are your goals for the day? What are you here for? What do you specifically need in order to assist with your care or assist with care after the hospital? Then halfway through the day, you go around again and you say, did we take steps in the right direction? Oh, we took a step back. So how do we keep on moving forward? How can I facilitate that? Do you want to talk to the social worker? Do you want me to page them for you? Just little things to bring everyone together to kind of help with mitigating the communication and assisting with teamwork. So as a nurse, I can still assist with the staff as well, not only just the patients. If someone needed assistance or didn't know how to do a procedure, I could go in and assist and teach them how to do it, or go in with them and just make sure that they are doing the right thing. Or a patient, his medication ran out and needs a new bag for the IV fluids or whatever it is. I can go in and I can do it. I can assist. I can give meds. I can do whatever I would need to be as a nurse. But then I can also be that extra resource on the unit. So I would love to do something like that that involves being a team leader and still assisting by the bedside and still assisting with the patients, but then also having that leadership role with it too.
Amazing. Well, I think no one's better qualified for you. So please let the Savvy Chat serve as our recommendation for Amber for such a position, should that open up in the future, because you, of course, would be a natural. And that's what I think is so great, again, is that you're not only wanting to connect with the patients, but you're training and helping others to have that connection too, because unfortunately you don't exist at all the different hospitals and clinics across where all of our patients are. And so we need to continue to replicate more and more of you. I think about one of my absolute favorite physicians that I've been seeing since I was 6 years old. I can't dream of a world where he is not part of my care team, but of course, no, at some point he will retire, which saddens me greatly, but I can only hope that he has trained other amazing people underneath him. And I think that's what we need to count on, is people training other people how to be such human-centered care providers. And I'm grateful that we have people like you. So before we close out, we got to ask you our rapid fire questions. So my first being, what do you do when you're not being savvy and helping others? What do you do for fun?
Sleep. I sleep. I starfish face first into my bed and sleep. No. When I'm not being savvy, I am singing. I love music. I am actually, I guess this still is helping others. I'm singing at one of the children's hospitals locally in Boston for the holidays. So I'm super excited about that. A group of us healthcare professionals are actually going to do that. So that is something that's extremely rewarding to me, but fun as well. So music has always been something that I love.
That's well, we have a shared love for music. I'm not a good singer, but I do love dancing, and we both know this, that we can bust some moves when we're together. So dance party. All right. Well, that's awesome that you're doing that. That seems really, like I said, rewarding to be able to give back and do something fun. I'm not going to put you on the spot if you don't want to, but do you want us to be your tester audience for what you're going to sing?
Oh dear. Me.
I don't know.
Let's see what I've got. Hold on. Hold the phone. So one of my dreams, since I was a wee little tot singing in the church choir, I always wanted to be a Disney princess. And I like to think that I am.
Obviously.
So, I mean, singing at a children's hospital, I feel as if I am obligated to sing A Whole New World from Aladdin because duh. And if we really do sing this song, I am dressing up and traipsing my way through the hospital. So let's see what I've got. A whole new world, a new fantastic point of view. No one to tell us no, or where to go, or say we're only dreaming. A whole new world, a dazzling place I never knew. But when I'm way up here, it's crystal clear that now I'm in a whole new world with you.
Yeah, that's amazing. I want to be one of the, well, I don't want to be one of the kids at the hospital, but I kind of do because I was that kid and I know how meaningful it was when people like you would come in and spend your free time bringing your talents and your skills, and I just know they're going to love it. And they're going to love the outfit that you come in too.
I mean, may or may not wear the belly shirt with all that. I mean, I have to be a classy princess, so I don't know, Jasmine.
Actually, Jasmine wears scrubs too, probably.
Yeah.
Girl. Amazing. All right. So now I don't know how to ask this question, but what's something quirky about you that people don't necessarily know?
Something that I don't even think my boyfriend knows.
Ooh.
I can sneeze on command.
Sneeze right now.
Straight up.
Is that real?
I don't know. Is it real?
No. Here's my talent. I can not sneeze. And it's because after my brain surgery, they told me I couldn't sneeze for 4 weeks. And it's amazing how you can shut it down if you think you're going to sneeze your brains out. So.
Oh, shoot.
I can do the opposite of you. So together, we're like a normal sneezer person.
Two become one with the sneezing.
Amazing. So what is one of the biggest healthcare headaches that you think that we have to address? And I love that you're coming from an actual patient care angle. What do you think?
I think one of the biggest challenges is time. I don't think we ever have enough of it. I go in the morning, it's 7 o'clock in the morning. I usually need to get report and have my coffee before I can be a normal functioning human being. But then the next time I look at the clock, it's 2:30 in the afternoon and I haven't peed and I haven't eaten. And I find that I'm getting very hangry in the patient kitchen and eating a snack pack pudding. I mean, you know, we never have enough time, but not only just as a provider, but everyone in general. I mean, we never realize how time is limited until we don't have enough of it. So from a healthcare standpoint, we can always find better uses of our time. And as a provider, find better uses that would be specific to the patients. So how can I utilize my time? Should I bring my computer in with me and physically sit down with them to talk through their assessment? What would be more beneficial?
Yeah, that's certainly something that we have more of in the clinical setting. We need it. All right, on to my favorite question. And I'm curious what you picked. Knowing your love for music, what song title do you think best describes the current state of healthcare?
Well, I don't want to be a Debbie Downer, but I also feel as if this is very accurate. You know the sad puppy song, the Sarah McLachlan, "In the Arms of an Angel."
Yes,
That's always coming on with like the malnourished puppies, and they're so sad in their cages, and they're like,
the ones that I'm like, we must save all the animals. Like,
I need to give them my entire savings account. Right meow, right meow.
I'm with you. We'll go to a farm and we'll build it. We'll just have an animal sanctuary.
Hey, I do have 2 acres of land, so come on over.
I'll bring the cattle and the cats and the everybody else. But
I'll
that's
take my neighbor's chickens.
yeah. What's the name of that song?
I think it's "In the Arms of an Angel." In the
That's
arms. Yeah,
Sarah McLachlan.
yeah.
So
Because
okay, why'd you pick it?
I picked that because I mean, the current state of healthcare is not really doing too hot right now, and there's always room for improvement. But whenever I hear that song, I think of how others need assistance. So whether it be malnourished children or sad puppies, that's just the song that I kind of associate with requesting assistance. So I think we all need to request assistance within the realm of healthcare. We need to continue improving, continue integrating technologies, and just improve overall care and quality.
Yeah. And if I can throw you, it's a great sort of lead in to say, what do you think our listeners can be doing in their day to day? Just simple acts of kindness to provide that to one another. You do it as a post-it note. What can you kind of leave our listeners with?
So I know that everyone is usually really big on social media, and a lot of times it's complaining and it's, oh, my day was terrible. Okay, but what was good about your day? And I think that a lot of times we just focus on the negative, where if you really think about it, any negative, whether positive or negative, doesn't matter what it is, whether it's an instance where you see negative behaviors, you can always find a positive and learn from it. So whether it's, I never want to act that way, I never want to be in this type of situation, or I learned this because I went through this, any negative can be a positive. And to just think positively and share positive thoughts, kind of reframe your brain of, instead of complaining on social media, how about I talk about what I can do to make a difference? Or how about I talk about the great things that happened and the kindness that I shared? I bought someone's donut in the Dunkin' Donuts drive-through line. Pass it forward, or like pay it forward. I think that we have so much negativity in the news and the world anyway, that if you're going to use social media as an outlet, vent about positivity or vent about how we can create positive change.
Well, I couldn't have said it better myself. Another reason that I want to plug Amber, if you are not already, you've got to go follow her on Twitter and Instagram. She's at Wheezy Nurse. You can also find her on her website, wheezynurse.com. We'll get some of that positivity because we absolutely need more of it. So, Amber, thank you so, so much. And before we close out, I want to remind our listeners that we're going to be off next week for the holiday. So, eat some extra turkey and take some extra naps. We'll be back on December 2nd with Michael McMorris from Pack Health. And we're going to be talking about how to actually be achieving some of these healthcare goals that people are setting. They do amazing work helping patients really work through the system and achieve their goals. So we're excited to work with him on December 2nd. So again, Amber, couldn't thank you enough for joining us tonight. You are a breath of fresh air in the healthcare system. And we wish you all the best with your singing endeavors in a couple weeks for the folks at Boston Children's. And we really just appreciate all the work you do for patients. So thank you, thank you, thank you.
And thank you so much for having me. I cannot thank you enough either for giving me the opportunity to share my story and to hopefully spark or pique some sort of interest within either nursing, education, patient experience and leadership, whatever it may be. Thank you, thank you, thank you.
Amazing. All right. Well, everybody have a great holiday. Enjoy with your family and friends and be thankful for all the amazing things around you. We here at Savvy are certainly thankful for you guys. It's really been an amazing journey, and we are just so grateful to have you here listening and part of our co-op. So until next time, stay savvy.